This is our podcast called Psych Talk 101, and episode one is going to be about hallucinations and specifically the effect of hallucinogenic drugs on the brain. And this is by Ariana Peters, Kaylin, and Emma. What are hallucinations? Hallucinations are defined as any perception in the absence of external stimuli, and there are a variety of types of hallucinations. Tactile hallucinations involve the feeling of touch and experiencing things touching the skin or movement on the body that is not actually present. Olfactory hallucinations related to the sense of smell, and this causes people to smell odors in the environment that are not actually present. Gustatory hallucinations are related to the sense of taste, and this happens when people develop unpleasant and often metallic tastes in their mouth. Auditory hallucinations related to hearing, and this is perceiving the voices or noises that are not actually present. And then visual hallucinations, things that aren't actually there, like visual representations of people or objects, or even like random patterns in the air. Schizophrenia is a mental illness that impacts your thought processes, emotions, and behavior. And hallucinations are one of the main forms that can diagnose schizophrenia. Auditory and visual hallucinations are the most related to schizophrenia, with found that 60 to 90% of patients had schizophrenia, and 16 to 72% of people with schizophrenia or schizoaffective disorder report the experience of visual hallucinations. The main causes of auditory hallucinations include peripheral lesions, auditory nerve disease, stroke, PTSD, and of course hallucinogens and schizophrenia, which we will be focusing on today. And then visual hallucinations are most often caused by neurologic disorders, migraines, epilepsy, affective and conversion disorders, sleep deprivation, and once again hallucinogens and schizophrenia. There have been studies that have found that people who experience auditory and visual hallucinations have their brain activity and cognitive processes are impacted. So a particular study identified different areas of the brain that were activated, and this was in both psychotic and non-psychotic subjects during the experience of auditory and visual hallucinations. And another study found that schizophrenia patients experiencing auditory hallucinations had deficits in their cognitive processes, such as speech, working memory, attention, episodic memory, and self-monitoring related to their hallucinations. Our hypothetical study uses psilocybin mushrooms to induce hallucinations in participants, and these are a psychedelic drug that are non-toxic and naturally occurring, and so they're like found to be non-addictive. There are two types of hallucinogens that exist. There's deliriants and psychedelics. Deliriants cause more intense hallucinations that often cause someone to lose all their lucidity and become like completely delusional, whereas psychedelics like psilocybin, people are able to distinguish their hallucinations more from reality and remain somewhat lucid and insightful, although they still perceive their hallucinations as very realistic. And there was one study in 1968 that was conducted using psilocybin mushrooms and examined hallucinations. There was only 8 participants because this is a very like non-traditional study, and like nowadays isn't necessarily ethical, which is why our study is hypothetical. But of their 8 participants from the 1968 study, they all reported visual hallucinations, and 25% of them also reported auditory hallucinations. So for our hypothetical study, independent variable is going to be the amount of hallucinogenic mushrooms administered. So participants can either receive a specific dosage of the psilocybin mushrooms or a placebo. And the dosages will be calculated based on like specific weights and heights, ranging from like 25 to 40 milligrams per participant. And then the dependent variable, we will be measuring brain activity using fMRI scans and cognitive performance using the mini mental state exam. So the hypothesis is that participants who receive psilocybin mushrooms will have a greater increase in brain activity, specifically in the brain regions related to auditory and visual hallucinations, as indicated by the fMRI scans, and then they'll have decreased cognitive performance, as indicated by declines in the MMSE exam compared to the participants who take placebo.
Be conducting our mock study. The methods we will be using with participants, we will be using 200 individuals. 100 of those will be participants who are diagnosed with schizophrenia and have a known history of reporting experiencing visual hallucinations or auditory hallucinations. Of those 100, the participants will be randomly assigned into 2 subgroups, which will have 50 individuals in each. One subgroup will be receiving mushrooms and the other will be receiving the placebo. There will be then a second main group of 100 participants with no known history of visual or auditory hallucination and no diagnosis of schizophrenia. That group will also be split up into 2 subgroups with 50 individuals each, one group receiving the mushrooms and one group receiving a placebo. How we will start our mock study, we will start it out with an informed consent, so that the participants know what they're getting into. They are allowing us to do this mock study to them. We will then have them fill out a mini mental state exam and a self-report survey. We will then take a brain scan of all the participants in an fMRI machine to get a baseline of the participants. We will then give the participants the placebo or the dried mushrooms, so containing the psilocybin to induce the hallucinations. About an hour after they are consumed, we will take another brain scan to get a reading of the participants' brains on the placebo or on the mushrooms. After about 4 hours, when the mushrooms wear off, they will then take the same self-report survey so that we can see the difference between their hallucinations and how they're self-reporting their hallucinations and how realistic they feel like they are after being medicated with the mushrooms. How we will get these participants, because it's a mock study, we're hoping we could do it through a clinic and that HIPAA wouldn't be a hard thing to get around, even though in reality it might. Theoretically, we could reach out to a clinic that is known to have participants in it or patients in it that are schizophrenic, ask them to reach out to those patients to sign a waiver that they are willing to give us proof with their medical diagnosis of schizophrenia, and they are willing to participate in the study. How we will get the other group, we would reach out to students on campus, because our students on campus are going to be in that average onset age of schizophrenia, early 20s to early 30s. So UWL students would perfectly fit that age bill. We would have this at a location at a medical facility so that we would have access to an fMRI machine.
The results of our hypothetical study did not fit in with our original hypothesis of people taking the psilocybin having the most active pattern of brain activity. We have found out that psilocybin can actually lead to a reduction in neural activity in some areas of the brain compared to others. But it also is known to increase activities in areas of the brain dealing with short-term memory and long-term memory. So those are kind of difficult to decipher in our hypothetical experiment here. But people with schizophrenia also have been known to have a decreased pattern of neural activity, and especially when it comes to performing different cognitive tasks, such as short-term memory or long-term memory tasks, decision-making, or emotional processing. So overall, we concluded from the results of the study that patients with schizophrenia would have the lowest neural activity and perform the lowest on the cognitive task process. So if our results did fit in with people taking psilocybin having the greatest amount of activity, this is kind of a representation that we found online of the different internodes between our brains while on psilocybin. Limitations of our study is for the cognitive performance test, there are many different aspects that could affect someone's performance in that, such as like the task difficulty of it and the cognitive load that comes with it. So not only would their hallucinations affect this, but there are some other things to be considered there. Another thing, hallucinations are completely unpredictable. So that makes them incredibly hard to study in a controlled environment. And for the psilocybin aspect of our hypothetical study, it's completely unethical to give people drugs, and especially if those people have a mental illness already. And not to mention, these probably wouldn't be under the most safe conditions, especially for people who are experiencing active hallucinations. Another limitation of our study is it would be insanely expensive to conduct with not only the fMRI machines, but having to obtain that many psilocybin mushrooms for our participants. Another thing that is a limitation to the study is that it's completely subjective. So the only people who know what's really going on are the people who are experiencing the hallucinations themselves. And also for the mushroom aspect of it, it would be kind of hard to determine the amount of mushrooms to give someone based on their height and weight without having prior research on that. So some criticism of the research, it is, like I mentioned earlier, incredibly difficult to do brain scans unless active hallucinations are present. And we can also not induce hallucinations without the use of psychedelics. And even then, it doesn't really compare to someone who is experiencing hallucinations on their own. It is also easier to conduct research in a non-experimental way for the topic of hallucinations. And another thing is there's only a limited portion of the population that we could use for this study. So it would be pretty hard to obtain participants all around for it. Another thing is hallucinations can essentially occur in anyone. So there was a mention of people experiencing migraines with auras. The aura was considered a hallucination. And hallucinations can also occur from lack of sleep. So there's a wide variety of like reasons why someone can hallucinate outside of just psychedelics and mental illness. So some future direction for the study of hallucinations themselves is that it is an incredibly complex topic. So they do have a lot of room for future studies and what they do with those. Future direction for people with schizophrenia is there's the use of antipsychotic meds, and these have been most helpful alongside CBT and other therapy programs. Family therapy has also been really beneficial for not only the person dealing with schizophrenia, but the support system surrounding them. And finally, group therapy has also been a pretty good future direction for people with schizophrenia to feel as if they're not alone in what they're experiencing.
that is all we have for our first episode of Psych Talk 101 about hallucinations.